Thank you all for being here today as we announce a life-changing public health initiative. The physical health and safety of our residents has been our community's top priority, and particularly over the past few years as we've worked to prevent the spread of COVID-19 together. And while we continue to provide vaccinations and boosters and community guidance about the pandemic is not the only health challenge that demands action in our community. We have long recognized the devastating impact that lead exposure has on children and families. And our public health and housing agencies have been leading our efforts to reduce lead exposure. And our work received a big boost back in October of 2020 when HUD awarded us a $3.4 million federal grant to identify and remove lead from the homes of our lower income families. Today, we are announcing a team effort to prevent lead exposure in our community and to keep our children and families safe. The Lead Safe Lincoln Initiative is a partnership among key city and county agencies and our medical community that will result in a healthier future for our residents. It's my pleasure today to welcome 4 partners in the Lead Safe Lincoln Initiative. We'll hear first from Dr. Erica Peterson, a local pediatrician with Bluestem Health. And following Dr. Peterson, we'll hear from Lancaster County Commissioner Sean Flowerday, who also serves on our local Board of Health. After Commissioner Flowerday, we will hear from our Health Director, Pat Lopez. And wrapping up today will be Dan Marvin, the Director of our City Urban Development Department. And I want to thank all of our speakers for being here this morning and for their leadership as we pursue a healthier community. And with that, I'd love to invite Dr. Peterson to come up and say a few words.
Thank you, Mayor. I appreciate the time to talk today about this important health issue facing our children in our community. Lead is a heavy metal that used to be used in a variety of products, including gasoline and paint. As the toxic effects of lead were better understood, they were removed from most routine use, but because they were used for so many years, we still have a significant amount of lead exposure in our community. Lead is a neurotoxin, so that means that it can permanently damage how the brain and the nervous system works. Because young children's brains are growing and developing so quickly, and they frequently put their hands in their mouths, they're at increased risk not only for exposure to lead, but from its toxic effects. This lead exposure has been linked to lower IQ or intelligence, as well as problems with behavior such as hyperactivity and learning issues. It can also have effects on other body systems, such as the kidneys and the gastrointestinal tract. Specifically, it can inhibit absorption of critical nutrients such as vitamin D and iron, causing problems with growth. So most children who have elevated lead levels are asymptomatic for a while, which is why screening is so important. Fortunately, lead levels can be detected with a very simple blood test. Now, over time, acceptable lead levels have really changed. Prior to 2012, children were identified as having lead levels of concern if they had a lead level that was 10 or more micrograms per deciliter or higher. Recently, that cutoff has decreased to 3.5, and experts now know that there's really no safe lead level in the blood. Today, lead exposure continues in our community, and as physicians, we see it frequently. Lead can remain in household dust. It can be in soil or water that's brought in by lead pipes. Some jewelry, old toys, imported ceramics, glazed dishes, as well as some imported spices and candies can also be sources of lead. So what can you do as a parent? First, try to reduce your child's risk to these high-risk areas mentioned above. If you live in an older home, specifically one that's been built before 1960, try to keep your children away from things like peeling paint, old windows, or porches. Try to avoid letting them play adjacent to the house, or try to cover those areas with mulch. Clean your home regularly and teach your children to wash their hands frequently, especially before eating. It's also recommended to use cold water and let the faucet run a little bit longer to reduce lead exposure. If you eat healthy, a healthy diet actually reduces the amount of lead that a child will bring into their body if ingested. And lastly, it's very important to bring your child for well checks, for scheduled exams, so that you can talk to your provider about your family's risk for lead and whether or not testing is appropriate. Once that lead exposure is identified, we as pediatricians and primary care providers are excited to partner with the health department to work to further reduce and eliminate, and hopefully prevent, ongoing exposure for these children. I just want to thank you for your time today to focus on this important issue facing our children in our community. And now I'm going to turn the podium over to County Commissioner Sean Flowerday, who also serves on the Board of Health. Commissioner.
Thank you, Dr. Peterson, for your expertise and for your commitment to our community as we address this issue. High blood lead levels is a hazard across our society, but it is particularly prevalent in older, more urban, and generally lower income neighborhoods where the element has been collecting for years. The CDC and Agency for Toxic Disease Registry have developed a social vulnerability index, which reflects the potential negative effects caused by external stresses on human health. Findings are clear that children living in census tracts that have higher social vulnerability index ratings are at increased risk of having elevated blood levels. Here in Lincoln and Lancaster County, some of the highest blood lead levels in children have been found in neighborhoods surrounding downtown and in the Lincoln High School area. Last night, in recognition of this threat to some of the most vulnerable people in our community, the Lincoln and Lancaster County Board of Health unanimously passed an updated blood lead level resolution. This resolution calls for ensuring that all parents, guardians, and children have equitable access to blood lead testing, enhancing communication to inform parents, guardians, and the medical community, as well as property owners, about the health risks for young children, continuing collaboration with the Lancaster County Medical Society to provide education and information on the importance and frequency of blood lead level testing for children under the age of 6 living in our county. And finally, monitoring the rates of elevated blood lead levels, investigating and addressing lead exposures, and identifying areas in Lincoln and Lancaster County to focus interventions, as well as tracking the impact and outcomes of lead prevention efforts. It's vital to the health and well-being of our community today and the future of our community tomorrow that we take action now to address this threat. I'm going to now hand the podium over to Health Director Lopez, who will speak about the specifics regarding how our health department is combating this threat. Thank you.
Thank you, Commissioner Flowerday. The resolution adopted by the Board of Health provides a formal framework for childhood lead prevention. I want to start off with some data about the number of children in Lancaster County testing positive for lead. There are close to 29,000 children ages 1 to 6 years old in our community. Around 3,000 are being tested for lead annually, and elevated blood lead levels are being detected in more than 100 of them each year. We know there are many more children that should be tested. As Dr. Peterson mentioned, there is no safe blood lead level in children. Testing is recommended between 12 and 24 months of age. Protecting children from lead is important to the lifetime of good health. Lead poisoning is completely preventable, and the health department is collaborating with healthcare providers to increase testing of children in our community and reduce the risk of lead exposure. The health department will be adding lead testing to the services we offer through our on-site public health clinic beginning July 5th. And will also be expanding testing to children ages 1 through 4 who participate in WIC, the Public Health and Nutrition Program that helps parents and families eat well and stay healthy. A start date will be announced later this summer. We have a strong relationship with the Lancaster County Medical Society, and we will continue to work closely with them and our local healthcare providers about the importance and frequency of lead testing for children in our community. If a child test does come back showing elevated lead levels, there are resources available to families. For the past 5 years, the health department has received grant funds to provide a public health nurse to assist families with children aged 6 and under who test positive for elevated lead level. What that means is we conduct an environmental assessment to determine lead risk. We assure access to their healthcare provider for follow-up, lead testing, and referrals to offer supports for the family as they are working to address their child's needs. In addition, we continue to provide lead prevention information and education to parents and guardians, ongoing communication with the healthcare family provider, and we also follow up testing and in-depth assessments of medical, environmental, nutritional, and developmental needs. Our public health nurses also coordinate with our environmental public health division. That team does home assessments and inspections. Much of the time, a child's elevated blood lead levels are caused by an exposure related to the home environment. Lead-based paint and lead-contaminated dust are the most hazardous sources that are found for lead in children, and some of the most common sources of exposure. Again, lead-based paint is really one of the, and dust are the most frequently identified sources of lead in the home. Lead-based paint is found in many homes built before 1978. As the paint breaks down over time, it chips and it can create lead dust that can contaminate the home and get on children's hands, toys, bottles, and more. Through a partnership with our city's urban development department, our environmental public health team conducts lead paint inspections and risk assessments on homes and apartment buildings. The lead hazards are identified and when they are, both departments work together to help make the dwelling lead safe. Now let's hear from Dan Marvin, Director of our Urban Development Department, on the work being done to make homes lead safe. Dan?
Thanks, Director Lopez. You know, we applied for this grant, a couple of years ago. We had pre-meetings, and I think the input that we got from the health department was valuable. It was a successful grant, and our initial grant was for $3.4 million to remediate 165 homes over the next 3 years. Generally, in communities that get the initial grant, there are supplement renewals that we would expect to be able to do, so we won't stop at that point. We will continue to keep applying and try to apply and remediate as many homes as we can. When we got the grant, it forced us to face some challenges. The first challenge that we faced, which we understood and knew, was we needed to have contractors who were trained, who could be able to go on site and do the remediation that was necessary. Our department recruited contractors, we trained them, there's an actual training process that they have to go through. We got that process accomplished, and then we were hit with COVID, which then created difficulties with social distancing and being able to get into various homes. And our latest challenge that we've had, so we've had the triple whammy here, but we're overcoming that one as well, is that we have supply chain issues. So if we have to order windows or doors, the lead time for the procurement of those types of items has taken a fair amount of time, but we're working through those issues as well. But if you believe you live in a qualified area or non-qualified, and I'll speak to that issue in a second, then we would want you to call or email our contact, which is, you could call area code 402-441-7808, or email J.M. Fitzgerald, which is JMFITZGERALD at lincoln.ne.gov. The Lead Safe Lincoln program is a free program targeting families with children under the age of 6. In owner-occupied housing, the children must be living there and under the age of 6, or in rental properties, we would be targeting families with children in those properties as well who are under the age of 6. Area median incomes do apply for the program, but, and we did when we originally applied for this grant, we were prioritizing certain areas of Lincoln. We've applied for a waiver, and so what I can say today is that If you are in a home and you have children that qualify, we will not use boundaries to determine whether we can remediate those. We are prioritizing certain parts of Lincoln, but we are including all aspects of Lincoln to be able to remediate those homes of the lead paint that's in the buildings. One last thing, the cost on the program is free, so please call the number that I gave earlier or email if you want to be able to have your building inspected. Thank you.
Well, thanks so much, Director Marvin, and to our urban development team for your incredible leadership to help remediate lead paint in homes, and we're so grateful to have that federal support. And thank you again to Commissioner Flowerday and the other members of the Board of Health for your resolution and leadership, and of course, thanks to our entire health department team and our partners in the medical community and Dr. Peterson. This is a collaborative effort, and we know that we can be successful when we're working in close partnership together to address important health issues. With that, anyone here would be happy to take any questions that the media may have about the Lead Safe Lincoln initiative. Any questions? Well, you guys hit it out of the park. There are no questions, but you know you can reach us if you have some after the briefing. And I'm just so pleased with this collaborative community effort. Thank you so much for tuning in today.